Now, the controversial digital vibes scandal could see the health department crack the whip on some senior officials. The 150 million rand contract awarded to the company for communications work landed the now former minister Zweli Mkhize in trouble, among others. You'll remember it was alleged that these millions were paid to his close allies. Online newspaper Maverick Citizen has confirmed that the SIU has now made several referrals. So to chat to us more about this is the newspaper's editor, Mark Heywood. Mr. Heywood, thank you so much for making time. These revelations of this corrupt digital vibes deal are actually shocking. We are really hearing from the SIU today that the digital vibes quoted about 141 million rand. The second bidder, which didn't get the contract, quoted 69 million rand. And yet digital vibes had only 1 year experience, and its quote was 72 million rand more expensive than the second bidder, which had more experience.
Yes, that's right. I mean, the SIU has done a very thorough investigation into the digital vibes contract. Its report to the president hasn't been made public yet, but what they have done is that they have put an application before the special tribunal to have that contract declared null and void in order to allow them to recover all of the monies that were incurred through the so-called contract with digital vibes. And that founding affidavit reveals a great deal of information, including, as you've correctly said, I mean, one of the things they point out was that 90 million of that 150 million rand was completely spurious, that it had no role, no purpose, no nothing other than to find its way into the bank accounts of the corrupt people who were involved in it. The SIU also say that they haven't been able to find invoices, that they've still not been provided with invoices for any of the expenditure by digital vibes. So clearly it is the scam of the COVID-19 pandemic so far.
The SIU also confirmed today that the health department and the presidency are currently drafting charges for senior, middle and junior officials that are implicated in this scandal. And really it's about time, because it's been a long time coming. We need accountability. Do we know which officials are likely to be suspended?
Well, Clement, I confirmed last night with the presidency that they had received a referral letter from the SIU concerning the Director General of the Health Department, that's Dr. Sandile Buthelezi, as well as the Deputy Director General, Dr. Anban Pillay. Only the presidency can say what they are doing with those referrals. I was just told that the president is busy consulting people who have been implicated in that scandal. So we know that there are 4 or 5 referrals for disciplinary action, but I think the health department and the presidency need to tell us what exactly they are doing with those recommendations.
What about Zweli Mkhize? Do we wait for the NPA to decide if they will prosecute? Because the SIU says he may have committed actions of criminality and failed to comply with the Constitution.
Well, the SIU refers to the NPA for further criminal investigation. I don't know if they have referred Zweli Mkhize to the NPA, but it's very, very clear from the papers before the special tribunal that he was perhaps architect is too strong a word, but he was certainly a facilitator of this contract. And what's shocking is it shows that he was really a facilitator from literally the first day he arrived in office. There's an affidavit from the former Director General of the Health Department where she reports that the issue was first broached with her and that Tahira Mata was introduced to her as the communications assistant to Zweli Mkhize at a cocktail party after his swearing-in ceremony. So, you know, the suggestion that he had no knowledge of what was going on seems to be betrayed by the paper trail of evidence that the SIU has compiled in the course of its investigation.
Yeah, I'm actually, as you are just detailing how much he was in the know, I'm playing back at the back of my mind the briefing that he called, I think it was at 7:30 in the morning, to tell us that he's not involved and that he hasn't benefited. And yet these are his comrades, and now we are understanding how his family and these close associates of his actually benefited from that loot from the health department. Let's talk a little bit as we wrap up about these suspensions. They are going to leave the department with some capacity challenges. I mean, this is at a time when you need all hands on deck in that department.
Yes, they're going to leave the department with very serious capacity challenges. That is, if these disciplinary inquiries and suspensions do take place. You know, Clement, I interviewed the Minister of Health last week, and he admitted to me that the National Health Department already has very serious capacity challenges. But if you're about to lose the DG, the Deputy DG, the Chief Finance Officer resigned about a month ago, the department really is facing a hemorrhage. And I think that government should be thinking seriously what it's going to do about it, because as we all know, we're at a critical moment in the vaccine rollout program, but we're also at a critical moment where we're seeing more and more the damage that COVID-19 and the response has done to other health programs around non-communicable diseases, HIV, tuberculosis, a whole range of critical health issues. And we need a health department that perhaps is the strongest that it's ever been in our democracy, rather than the weakest that it's ever been in our democracy, which is what it faces at this particular moment in time. So I think it's an issue that we have to continue to ask questions about. Otherwise, the repercussions of these suspensions will be enormous. Now, these suspensions have to take place. Criminality, malfeasance, financial misconduct has to be investigated and it has to be prosecuted. But at the same time, we need a strong health department.